Hello, my name is May Kwong, the Executive Director at the Center for Connected Health Policy. Today, I'm going to be talking to you about MedPAC recommendations on telehealth. Please note that today's video is dated March 29, 2021. A few disclaimers before we begin. Please know that any information provided today should not be considered legal advice. CCHP always recommends that if you are interested in a formal legal opinion, to please consult with legal counsel. Also know if I happen to mention a company or show some type of product, know that neither I nor CCHP has any type of relevant financial interest, affiliation, arrangement, or relationship with such company. A little bit of background on CCHP. We were actually started as a California telehealth policy organization in 2009 as a program underneath the Public Health Institute. An opportunity to become the federally designated National Telehealth Policy Research Center became available through a grant from HRSA in 2012. CCHP applied for that. We've been serving in that capacity ever since. We also work with a variety of other funders and partners on the state and federal level on specific telehealth or connected health projects. We are also the administrator for the National Consortium of Telehealth Research Centers, which is made up of the 14 telehealth research centers underneath the same grant program as CCHP with HRSA. And we are the convener of the California Telehealth Policy Coalition, which is made up of over 100 statewide and national organizations that are interested in advancing telehealth policy in the state of California. As many of you know, COVID-19 dramatically changed the landscape for telehealth, and there were multiple changes made both on the federal and the state level. However, many of these changes are temporary. So the question now is, what do we keep around permanently of these temporary changes? And that is a debate that policymakers both on the state and federal level have had. Now, MedPAC has issued a report to look at the Medicare temporary changes and what of those changes that they are recommending to Congress to keep around at least for a period of time. A little bit of background for those who are not familiar. What is MedPAC exactly? It's a nonpartisan legislative branch agency that provides Congress analysis and policy advice Medicare. It's actually been around for quite a while, there for about, close to 2 decades, a little over 2 decades, sorry. And it is made up of 17 commissioners and it regularly reports to Congress. In those regular reports, they issue regular reports on their recommendations on what to do with the Medicare program. A recent report that was issued this month, March 2021, contains some telehealth recommendations that they have made. And these involve the temporary recommendations that were made in response to COVID-19. So what are they? Basically, they are offering or recommending to Congress a temporary extension on some of the policy changes. And specifically, they're saying continue audio-only coverage, but only for certain services, and to continue reimbursement for some services if there is potential clinical benefit to the patient. They also allow for coverage for specific telehealth services based upon location. So removing like the geographical limitation and the home limitation. Now, keep in mind, these are all temporary extensions that they are recommending. So MedPAC itself is not recommending that anything be made permanent, just that there be a temporary extension of maybe 1 or 2 years to these specific policy changes that we saw during COVID-19 pandemic. What they are saying also that with these temporary changes, when the public health emergency itself is over, that the rates be paid at a non-facility rate, which actually at the facility rate, not the non-facility rate. So during the public health emergency, the rates that were being paid were a non-facility rate, which is slightly higher than the facility rate. So MedPAC is recommending that when the public health emergency is over and we have this temporary period where we are extending some of these changes, then pay that at the facility rate, which is a lower rate than what you were seeing during the public health emergency. They are also saying that if the public health emergency is declared over and we are still in some of these changes stick around temporarily phase, that the provider should not be allowed to reduce or waive cost sharing costs, which again was another change that happened during the pandemic. MedPAC is saying, don't keep that around for this other sort of temporary phase once the public health emergency is over, where we're keeping around some of the telehealth policy changes. They also made recommendations around fraud prevention. So they were said to, look a little bit more closely at some of those outlier clinicians, which are clinicians who seem to be billing at a high number of telehealth visits, that may be a flag for fraud. So to look closely at them. They're also recommending that there be a face-to-face visit before ordering high-cost durable medical equipment or high-cost lab tests. So this is requiring some type of in-person type of visit before these high cost items are ordered. And also to prohibit institute to billing for telehealth by a clinician who can bill Medicare directly. So these are things that MedPAC believe will help reduce fraud in telehealth if these were like put into action. What's missing from their list of recommendations, though? So remember, when we went into the pandemic, there were a lot of temporary waivers that were issued, and a lot of them had to do with what services were covered, where the patient was located, what modality was used. And those elements, the MedPAC recommendations for a temporary extension do touch upon. But one thing that they did not touch upon was expanding the list of providers. As many of you recall, when the pandemic first started, the list of eligible providers in Medicare to provide services via telehealth were expanded, notably for FQHCs, RHCs, OTs, and PTs. MedPAC did not include that among their recommendations. Also, what happened at the beginning of the pandemic as far as the waivers were concerned, or the relaxations, were some of the HIPAA relaxations that we saw take place. Again, MedPAC did not recommend that be extended into that sort of temporary phase that they are suggesting happens after the public health emergency is declared over. So overall, what MedPAC in summary is recommending is that nothing be made permanent right now, that there just be sort of a grace period after the public health emergency is declared over, where some of the temporary changes are extended. But they did not say all of the temporary changes should be extended, just some of them, primarily the audio only, some of the services that were allowed, and some of the location limitations. They also did recommend a couple of other things that we don't currently see right now with telehealth also be included, notably that there be like a face-to-face visit before you can prescribe an expensive durable medical equipment or like some expensive lab tests. So these are some of the things that have happened with the MedPAC report. Now, these are just recommendations. These are recommendations that this body is making to Congress. Nothing has been taken up just yet as of, again, the date of this recording, which is March 29th, 2021. However, I think we should note, though, that there, to this point, has not been anything in Congress really solidifying or making permanent any of the temporary changes so far. So this has been one thing that I have flagged, that if something was going to be made permanent after the public health emergency is declared over, I think there were a couple of opportunities Congress could have taken to do that, notably the Consolidated Appropriations Act, passed back in December of 2020. That opportunity was not taken, and nothing happened in the Reconciliation Act, which passed just a couple of weeks ago as well. So I think there may be some possibility that some of these MedPAC recommendations might be taken up for Congress. I think probably just the concept of having this sort of temporary type of extension after the public health emergency is over, keeping some of the telehealth waivers around, is a likely scenario that will uh, allow the policymakers to gather more information before they are forced to make a final decision. But we aren't quite sure yet exactly which direction they're going to go. This is just a guess on my part. So that is all I have for you today. Just wanted to make sure that you were aware of it. Again, these are some links on the CCHP website. I suggest that you really keep your eye on it. Also subscribe to CCHP's newsletter so you can be aware of any new or breaking information. And I just thank you for your time. Have a great day and stay safe.